last topic of the first session is Veganism in CVDS by Dr. Mansi Patil. So please welcome Dr. Mansi.
A very good morning, everyone. And at the outset, thank you to the Cardiabcon team for the wonderful arrangements and this innovative conference where we are getting all doctors and dietitians together on board. A special thanks to Dr. Ashutosh Mishra, whom I have personally never met, but the energy that he exudes is fantastic. I think the speakers before me have done a fantastic job of setting the stage for me where I talk about veganism and cardiovascular diseases. Thank you. So I guess in the past decade or so, this is where we've started talking about veganism. When we were doing our medicine, I doubt if someone really spoke about veganism there. Someone rarely spoke about diet, basically. So this trend that has come in, it's very important to first understand what veganism is and is it different from a plant-based diet? So just to give you an overview, veganism is a way of life. It is where you adopt a life where you refuse or you do not want to have any animal product, and that includes as simple as wearing a leather belt. So you do not have or you do not use a leather belt as well. That is one major point where veganism differs from a plant-based diet. The other aspect being, when we say a plant-based diet, with a plant-based diet we are not outright rejecting animal food items. In a plant-based diet you would still have smaller components of animal-based foods. How do I change the slide? Yeah. So like I said, it's in the past decade or so where we've seen an increase in this trend of veganism, as very well shown by the international standards where we measure the consumer products and the sales of consumer products, where the vegan food market has gone up drastically. So from 2015 to 2025, the expectation of the vegan market is to almost triple. But that gets us to a point: what is the evidence and do we have facts to support a vegan diet? Honestly, if you ask, meat has been linked to 9 major diseases, but as very rightly said by the speaker before me, it depends on how much are you consuming. As Indians, maybe the consumption is once a week, maximum twice a week, except for probably the coastal regions where it is more of a fish intake. And even in that once or twice a week, the amount that we consume is maybe barely 75 to 100 grams per session of what we are eating. But yes, if the consumption is higher, especially if you are looking at the red meat consumption, we are looking at 9 major diseases. And that is why the focus has shifted to a plant-based diet, which would help in reduction of the oxidative LDL levels. It will help in reduction of the pro-inflammatory activity that is happening. It helps in the reduction of endothelial dysfunctions that are there. The HSCRP, the IL-6, the TNF-alpha levels will fall down. Whereas, on the contrary, if you look at the Western diets, we are looking at a very high inflammatory burden. But that is not only because of following a vegan diet. There are other components also to it where we are looking at lifestyles as well. The moment you adopt a veganism way of life, you are being conscious of what you are eating. And thus, it will not just be about avoiding animal products, it will also be about rightly choosing what you are actually eating. So if you look at a vegan diet, or if you look at a healthy diet, as I would say, we are looking at a reduced inflammatory burden, we are looking at reduced oxidized LDL levels, and thus we are looking at a lower cardiovascular risk. But yes, major studies have mounting evidence about veganism being healthy. Now, one, there are very, very few studies which focus on an Indian scenario. So the evidence that we have is from a the Western world, where the adoption of a vegan diet, if you see here, shows that it is statistically significant. Now, most of these studies, if they are from India, the smaller studies that are there, they have not gone beyond doing a descriptive analysis. So as I guess researchers, as clinicians, we understand, a mere descriptive analysis will not help us create evidence until and unless we go further. But yes, there was a randomized control trial which looked at the protein completeness, it looked at what its effect was on non-diabetic obese. But again, as many other studies, this was confused with the vegan study, because this is actually a vegetarian diet that was followed, which did help the Asians to reduce weight and have a better anthropometric profile along with better glycemic control. There was a study by which the American Heart Association has recommended, which talks about the anti-inflammatory effects of a vegan diet, and they did say that in patients who already had coronary artery disease, a guided medical therapy, in those cases, if the vegan diet was adopted, that is when it reduced the cardiac endpoints. So that gets us to a point that when and where do we start using vegan? Do we start using vegan as a preventive profile, or do we use vegan diet as a therapeutic profile? Now, the question I think very rightly posed by my previous speaker was the quality of protein, especially if you're talking about veganism. So yes, if we are looking at protein quality, if you take it independently, I mean, if you look at just cereals, if you look at just pulses or legumes, the protein quality would be poorer. But very rarely would we advise a patient to consume only a single food group. We encourage food diversity. We encourage a person to include what we call as a rainbow diet, if nothing else, as in very basic, to talk to patients. And that is where we are looking at complementary value of protein. So you're combining two different types of proteins to increase the amino acid composition. Ultimately, it is the total amino acid that you're having. The essential amino acids need to be there. And if you are able to combine them, it will help. It will also help in reaching the adequate protein intakes. But again, the average protein consumption, as Dr. Chavi did point out, is very low for Indians. It is not consistent as well. So there will be days where we have a higher consumption, and then we have multiple days where either it is a fast. So if you look at a fasting diet, it is primarily carbohydrates. Whichever part of India we go, it is mainly carbohydrate-based diets and not a protein-based diet. So the challenge is not just with the amount, it is with the quality as well as the consistency with which we are consuming. This gets aggravated the moment we are talking about, a person who's got cardiovascular diseases, who is looking at glycemic variability. It gets aggravated in those cases. Now, if you look at the comparison between, let's say, Asians and the Western world, especially the United States, typically, most studies have found that the total cholesterol levels were lower. Now, this happened if the way the sample was collected in this case was these people who were participants of the study from an Asian perspective were people who already had a dietary guideline given to them. So again, that is where the data gets skewed. The Seventh-day Adventist study, or the Adventist Heart Study 1 and 2 both, talk about the risk of the ischemic heart disease, and they had compared the cardiovascular risk between vegetarian and non-vegetarian men, and there was a reduction in the risk of people following a vegetarian diet. Again, please be mindful, this is again a vegetarian diet. Very few studies focusing primarily on veganism. So again, for vegetarian, there was a reduction, and we were looking at almost just 21% of the men with a higher risk of ischemic heart disease. I think the EPIC study, very rightly named EPIC, is actually EPIC. It has multiple arms and it has multiple outputs. But the one that was most relevant to my topic was this slide that I could come up with, where it said that if a person was a meat eater, the total cholesterol levels were highest. For a fish eater, it was slightly lower. For vegetarians, still lower. And for vegans, it was much more lower. Again, maybe the most important point to understand this and then replicate in our practice is that this was again a non-Indian population. Now, as Indians, even if we ask here in this August audience, how many of us are consuming curd or milk on a daily basis? Milk in what form? So we have 3, 4, 5 people only. Now, how many of us how about if we take out milk that is being consumed via tea, any other source of milk and curd, then how many hands do we have up? So that's gone down by half, right? So my point being, inherently probably as we become adults in India, 80% of the population is 80% of the times vegan. Maybe some of our sweets have, milk. How many times a day, how many times a week are we consuming those sweets? Except for tea, which personally for me, I guess it is a lifeline. But yes, how many, apart from that tea, how much milk or milk products are we consuming? I'm talking about me being a vegetarian. So from vegetarian to vegan, if this is the difference, then somewhere we fall between vegetarianism and veganism. We are somewhere hanging between the two categories is where I would say Indians stand. Now, there was a lifestyle heart trial, which I feel is one of the most important, doable, and replicable for practice kind of trials, because this is a trial which said that it is not just the diet. It is the, as I always say, it is a framework that we need to work with. We are looking at us as individuals, as a family, as a society. We are looking at personal choices that we are making, where we are looking at a proper dietary intake, so low saturated and low trans fatty acid intake. You increase the PUFA and MUFA, but maintain the percentages. The percentages required between PUFA and MUFA are somewhere between 5 to 6 by 1, which we have increased to 20:1. And that is one of the points of being pro-inflammatory diets that we have with us. Vegetarianism, yes, if that works for you, but apart from that, we are looking at least modest exercise. Thank you. So at least modest exercise on a regular basis is required. Other lifestyle choices, be it alcohol and smoking, again, I guess everyone of us here knows. Stress management, very important, because we are not just talking about the work-related stress. Today we are talking about, as a society, the kind of stress that we have all created. Microbiome, I would probably not talk about, because that has been extensively spoken about recently by, I think, Dr. Renu. And yes, we do need to look at reducing the TMAO levels, which will help in reduction of cardiovascular diseases. But as a vegan, what happens is we are looking at certain nutrients landing up being deficient. So one of the most restrictive diets probably becomes a vegan diet where we are looking at a lower levels of calcium, vitamin D, vitamin B12, proteins, omega-3 fatty acids, iron, zinc, and iodine. And if you look at the status that is there for veganism, if we do a blood analysis, we do realize that vegans are the ones who have maximum supplementation, and thus a vegan diet becomes sustainable. And thus, if you are looking at supplementation, then yes, we can maybe opt for veganism. Now, this is just a study which says that it is micronutrient deficiency, yes, but you can still achieve protein adequacy if you are a vegan. Lot of diets, again, a difference between omnivorous, vegetarian, and a vegan diet has been shown that we can achieve the similar carbohydrate, protein, fat percentages. And just the last slide. Ultimately, for a plant-based diet, diversity will matter to a very large extent. It will matter how you combine your different food items, what are the different sources of proteins, carbohydrate, fats that you choose. Because if you are a vegan, the propensity for consuming maybe a higher cereal-based diet becomes more. But ultimately, it is up to us for how we strike that balance and how we are able to, look at the history of the patient and then advise the best diet that's suitable for them. Thank you.
Thank you, Dr. Mansi, for such an insightful session. With this, we conclude the first session of morning, and the next session will be starting soon.